My name is Jason Zook. I am originally from outside Chicago in a small town called Naperville, or what used to be a small town called Naperville, Illinois. I am currently married. I have a beautiful wife, April, a son, Jackson, who's 3.5, and we have a daughter that's going to be delivered here within the next several weeks. I've grown up moving around. I'm no stranger to moving. I lived in Minnesota for a few years. I lived in Louisville, Kentucky for several years. I went to middle school and high school, and then went to college and spent time for 8 years in Winston-Salem in school, and then went back to Chicago where I met my wife. And then my first duty station with the Navy, I went to Naples, Italy. Spent a couple of years in Naples, Italy, and then came back and did a fellowship in Louisville, Kentucky again, a spine fellowship. Finally followed by 3 years in Portsmouth, Virginia. And now we're here. So we've been moving around quite a bit, but we're happy to finally landed in the right spot. 1998, my senior year in college, I took a commission, and that summer before medical school started, I went and did at the time they called OIS, or Officer Instructor School, which was up in Newport, Rhode Island. And then I was an inactive reserve for about 9 years while I went to medical school and residency. And then in 2007, I did my first formal duty station. I got kind of squared away, as they say, and went first duty station in Italy, which was a really tough place to be right out of residency. We were very, very fortunate to get that. So I was the staff orthopedic surgeon, and my second year there, I was the department head for orthopedic surgery, and I was in charge of division officer, nurse, some nursing, and ancillary staff. I spent about 6 months in Kandahar province at the Role 3 NATO military hospital there from summer 2011 to January 2012. I was in the department head for orthopedic surgery there. I was a staff orthopedic surgeon. So although I'm a spine surgeon by specialty trade, I'm an orthopedic surgeon first and foremost. And my job there was to perform the same jobs, essentially, that I would do here, although obviously much more focused on trauma, and obviously very intense trauma compared to what we see here on a daily basis. It was definitely an eye-opener and an extremely humbling experience. I had done my residency training in Chicago and spent time at several level 1 trauma centers during my residency, and I had somewhat foolishly thought I'd seen most of what I needed to see in terms of trauma, certainly high-speed vehicle collisions and gunshots, stab wounds, things of that nature, but it is really just a completely different ball game completely over there. The level of energy imparted by these blast injuries, high caliber weapons, etc., it's just astonishing. It's just really, really humbling, the amazing injuries that these people sustain. I had the privilege of taking care of not only our NATO fighting personnel, but also the Afghan National Army, Afghan National Police, even detainees, so the bad guys, quote unquote, and also people caught in the wrong place, wrong time, including lots of children. So it was definitely an eye-opening experience, and from the get-go, I got there in the summer, the heat of what they call the fighting season. So there wasn't really not an opportunity for me to kind of get settled in. I had to kind of, as they say, drink from a fire hose and really get kind of comfortable really fast. I didn't really have an opportunity to even let it set in. As a matter of fact, I think I'm still processing a lot of what we saw and experienced to this day. The Role 3 hospital, about the year or two prior to my arrival, had been converted from a wood structure to what we call a brick and mortar type facility. The idea being it's a little bit safer from rocket attacks and explosions and things of that nature. In addition, my barracks that I stayed in were rocket proof, supposedly, although I'm glad that was never directly tested. So I had that good fortune to, when I put my head down on a pillow at night, I felt a little bit more safe than some of my fellow co-workers who were at more remote facilities, what we call forward operating bases or FOBs. But the average day is basically we would get up in the morning, go into work after breakfast, and do cases somewhat similarly to what we would do here. I would have patients that continually needed repeat procedures, and we would have them scheduled on the board, kind of like you would see here in an operating room. We would have scheduled clean-outs, debridements, what we call that, manipulations. Most of the patients that we saw continually were either patients too sick to travel, that were our NATO personnel, or patients who are local nationals. They had nowhere else to go. The medical system in Afghanistan is very primitive, and so if they came in to see us, we really pretty much treated them until we were finished treating them. And then throughout the day, whenever a trauma comes in, we are notified through our central operating command in the emergency room that something is coming in, and our pagers go off, kind of similar to a pager going off back home. And we get sometimes a lot of information about what's coming in, sometimes very little information. We get patients coming in at that point either from point of injury directly to us, or sometimes transfers in from another smaller forward operating base, the FOB that I mentioned earlier. And it can be anywhere from one person up to 9, 10, 11 people at one time. And so everybody mobilizes, and we wait in the trauma bay, similar to a trauma facility. And as soon as they come in, we start triaging and treating as appropriate. And so the triage, advanced trauma life support training that I had received certainly put me in good stead with the process. But again, the numbers and the quantity of patients, the level of injury is just so much more severe than anything I'd ever experienced before. I think it's affected me on several levels. First of all, as a person, it gives you an appreciation for life in general. It gives you appreciation for the little things. They always say the adage, don't sweat the small stuff. And if spending time in Afghanistan doesn't put life in perspective, quality of life, how you spend your life in perspective, I don't think anything will. I certainly would like to consider myself keeping things in perspective, but as like most people, we get caught up in the daily minutiae of things, and certainly 6 months there, you leave there with all 4 limbs and your eyes, and your ability to interact with the world around you that a lot of people leaving there don't get anymore, or if they leave there at all. And so I think that first and foremost, it really just humbled me as a person just to know how privileged I am to live in this country, and also to have all my faculties and senses about me when I leave there. It's just the injuries are so devastating to these people, and so many are so young, and their whole lives ahead of them, and they're forever changed. It's just amazing, these young soldiers and young children that are injured, just the willingness to kind of push on, carry on. A lot of times we see people who are injured and are just begging to be back out in the fight, so to speak, and be back out helping their fellow soldiers out. And it really, I'll tell you what really impacted me more than anything was probably watching how these soldiers who are out in the front lines, who are really putting themselves out there, have to go on and carry on day in, day out. I have just the utmost respect for these people, because I had it easy compared to what they had to deal with. I had these guys would come in and would have been hit multiple times by IEDs, would lose their colleagues, and have to go right back out the next day. I remember, at one point, a convoy was hit on the way to a memorial service for the same convoy that had been hit a couple days before, and so people were killed on the way to be memorializing other soldiers that had just died, their friends. And it's just it's heartbreaking, it's heart-wrenching. It just really tears you up. You really almost don't even have the chance to really process too well as these things are happening. Obviously, I'm very proud of our hospital. We did a great job, and we had a extremely high survival rate. If you were to come into our hospital with a pulse, your chances of surviving and leaving with a pulse were over 98%, which is amazing. But obviously, unfortunately, not everybody was successful in surviving. And on a professional level, I think it was very good training experience. I certainly am comfortable in any type of trauma experience now. I don't think there's any situation that would come in that necessarily would make me scared or afraid to take care of. I would never go so far as to say I've seen it all or done it all or I'm an expert in anything, but I certainly feel comfortable giving it my best to take care of someone and stabilize and also to know when it needs to be taken to the next level of care. One of the things that's important in the military system, we've gotten very good, fortunately or unfortunately, with several war experiences, is that every time we have a war, we get a lot better in terms of triage and making sure that people get the best care they need at the time they need it, and then getting it on to a more specialized center when it's appropriate. So I certainly, from a professional standpoint, feel much more capable in the trauma setting than I did before.